voters need to watch for their ballots arriving by mail in late July.
Following the instructions, seal your ballot in the envelope provided and be sure to sign the back.
Envelopes without your signature will not be accepted.
Look for your free elections guide in the newspaper or at these locations statewide.
There are no polling places.
So be sure to mail your ballot at least 5 days prior to Election Day.
Hawaii votes by mail.
Well, aloha and good morning. It is Monday, August 3rd. I'm Ryan Kalei-Suji, joined by Yanji Denise. This is Spotlight Hawaii. We want to thank the Office of Elections for sponsoring this conversation and helping us to engage you, the public. Of course, we know the election is coming up this week, but we also are going to be talking today to Governor David Ige, who will be joining us in just a few moments. He's wrapping up a meeting right now, but we should expect him any moment.
That's right, and we have so many questions to ask him. This month, we are shifting the spotlight, so to speak. That's the idea of this show, is that we start with one topic. We do it for a month. Last month was politics, so we focused on the Honolulu mayors. This month is the economy, so all of our guests on Mondays and Wednesdays here at 10:30 on the platforms of the Star-Advertiser will focus on the economy, and who better to talk to than the governor. Of course, we are going to, be talking about schools, about Trans-Pacific travel, about testing. All of that, of course, relates to the economy, Ryan, and some pretty grim headlines all throughout the weekend.
That's right. We saw those triple-digit numbers last week. We saw a little bit of a dip on Saturday, but yesterday, even those counts of 45 positive cases, really not a clear indication of the statewide total for the day, as there was sort of a delay in testing results being reported back to the Department of Health. So one of the questions that we want to know from the governor coming up is if the numbers that we see today will be a culmination of all of that. And so to get to that, as well as many other questions that we have, we want to bring in Governor David Ige joining us now here live. Governor, great to see you. Good morning.
Good morning. Thank you again for giving me this opportunity.
Yeah, it's been a month or so since we last spoke to you here on this platform. Clearly, things have changed. We're seeing those increased numbers. What are your thoughts on the path that we're heading towards right now?
It's clear that people have kind of relaxed a lot, and as we're seeing numbers, we are seeing a lot more private gatherings and clusters being triggered by birthday parties at the beach and in parks. Certainly it's been a wide range of private activity that demonstrates that people are really relaxed, and people are gathering in groups, and that's what's caused the surge.
We want to get to questions right away. Please leave your questions in the comments for us. Chelsea Dustin asked the question on everyone's mind: will a statewide shutdown happen again? What's the trigger for that, and what are you considering right now?
We've been talking about it for the past week and a half, 2 weeks, just looking at what additional actions can we take to reduce the number of cases. We did reinstitute the limit on social gatherings to 10. Once again, we believe that any kind of social gathering at this point, especially in unstructured situations, potlucks at home, we've seen cases within the workplace during lunch and others when people are not wearing masks. So we are looking at it. There's no hard trigger per se, Yanji. Again, we are looking at the healthcare system, making sure that we have capacity. We do have testing and contact tracing in place. So, it was expected, but we definitely have to slow the increase in the cases that we're seeing.
We saw over the weekend people still gathering. Of course, you've been calling for people to practice this physical distancing, wearing masks. There were people gathered, of course, at the parks. We saw a large gathering over the weekend on the North Shore for Waimea Bay, where police had to step in there as well. Is that something that we could see again? Is the shutdown of these beaches and parks, or is that something that you're going to leave for the mayors to decide for each of the counties?
We have been working with the counties, and they have instituted actions on Kauai and Hawaii Island, on Maui. And we continue to work with City and County of Honolulu. to reinstitute the limit on gatherings in parks and on the beaches.
And to that end, April says, what are you going to do to enforce social distancing? Nothing is being done. That's April Manijo writing in today. Should we, as Ryan pointed out there, some of those gatherings, should we expect increased enforcement?
We are definitely talking with the mayors about enforcement. We have heard from many, enforcement in virtually all of the areas that we have restrictions in place. I know that I've heard that they don't want us to shut down all the bars. Why can't we be focused on those that refuse to implement physical distancing and limit the numbers in their bars? Same thing with restaurants. So we have heard from many, and we are working to develop better systems to enforce in all the different areas. And physical distancing out in parks and at the beaches are clearly one of those areas that we are thinking about what would be better ways to enforce the restrictions.
Another question that we have coming in from Kyla asks, will you be opening for visitors on September 1st? We know that that has sort of been that target deadline, but date, I should say, but we have seen those numbers increase. Is that something that the state is still gearing towards, or is it more realistic that that date will likely be pushed back?
Ryan, we are working to finish all of the work that we need to do for September 1. And, putting up a digital platform that allows us to better enforce and implement the 14-day mandatory quarantine. And then obviously that system would be expanded to capture the pre-travel testing as we approach September 1. So we continue to implement all of those systems. There is more work that needs to be done. Yes, the number of cases here would have an impact, the number of cases in key markets on the mainland as well. And as we've seen in many of those jurisdictions, it's even hard to get a test for those residents in those areas. So we continue to expand the network of organizations and businesses that are willing to provide a pre-travel testing for COVID-19 and whether they'd be able to get the results back in the 72 hours.
We know that hotels and especially the airlines as well, they need some lead time. We've talked about that before. We know that Hawaiian Airlines suffered a great deal because the August 1st deadline was pushed forward. And that airline, is so important to our islands, but it's just hemorrhaging money right now. And it's not the only one. When do you have to make that decision? Because it's not like they can flip a switch and just start the planes up or flip a switch and have all the hotel workers back. So when are you going to make that decision, and what is going into that right now?
Certainly I've heard loud and clear from the hospitality industry that they need lead time. Hotels have said 4 weeks or more, airlines probably more flexible. Mainly because many of their aircraft are just not flying right now. So they would want at least 2 weeks of notice. And so, as I said, I'll be meeting with the mayors again. We'll be talking about that. We will continue to work to put the systems in place that's necessary that would allow us to implement on September 1st, if we can get a hold and contain the virus here in our community to a much larger extent than we have been right now.
Another positive announcement that sort of came out last week was Japan allowing for Hawaii to be one of those destinations that would allow for travel to and from. Is that continuing to move forward? Could Japan be that travel bubble before the U.S. mainland on September 1st?
Yeah, people have asked me that, and clearly if we can get the agreements in place, that would be, as I've told you before, Ryan, there's not an explicit sequence that needs to happen per se. We do believe that pre-travel testing is a way to accelerate bringing travelers from around the Pacific. If we can get agreements in Japan, we're having the same discussions about pre-travel testing 72 hours ahead, being able to get the results prior to departure. Those same elements, in our conversations in Japan, they are working to develop the partners to do the tests, making sure that they can turn it around in the 72 hours again. So all of those kinds of activities continue, and if they are already ahead of the domestic U.S., then we clearly would want to move forward with that. As you know, the virus activity is not as out of control in Japan or South Korea as it might be in the U.S.
School was supposed to start tomorrow. Obviously, that got pushed back. But what do you think is going to change? Will the DOE be ready by August 17th? A lot of this, of course, is out of their control. As the virus surges, they can't necessarily control that. So what are we really thinking school is going to look like? And a second piece to that is, the state is basically one DOE, right? All the islands fall under the centralized control. But could we see a situation where, Maui County or Big Island, some of those places, they really don't have the same level of virus that we have. And those students are essentially suffering because of what's happening on an island, those residents have no control over. So would there be a circumstance that you think that the DOE could make some kind of a neighbor island exemption so that those kids could at least go back to school?
Yanji, we have always been looking at the restarting of school as a county by county possibility. As you said, and in my conversations with Dr. Kishimoto and members of the board, I do stress the fact that the virus activity on all of the neighbor island counties continues to be in containment and under control. And yes, it is possible for us to have different policies here on Oahu versus the neighbor island counties. And so we would be looking at it. The other thing that we've discussed with the superintendent and the Department of Health is that, school closures, once they are reopened, can be looked at on a school by school basis or even a building by building basis within the context of a school. It just depends if there is a positive COVID case. Where is the case? Is it a student or a staff? How much interaction the individual may have had with students and staff, and what would be the appropriate reaction to that case on a school campus. So, there's been lots of conversations about when it would be appropriate to shut down a building within a school, more than one building, and then a classroom, starting with a classroom, and then ultimately a school without shutting down the entire system.
What is sort of, I guess, the criteria to decide at what point in time if the DOE will move forward and continue to move forward before that date gets pushed back again? But maybe higher case counts. We know that when you look at some other states, for example, New York's governor is saying that if positive test is less than 3% over a 7-day rolling average, then they will allow for schools to resume. They sort of set up as their threshold. Is that something that the DOE could be looking at? Is looking at data to kind of help to dictate if schools will open or not?
Certainly that kind of, we are looking at setting criteria. I know that that question has been asked. And as we've looked at other jurisdictions and other states, the percent positivity rate is clearly one of those that comes up as an indicator that we are looking at. So, Ryan, we're looking at all of these areas and looking at the decision criteria. If a school is, if we do believe that there is too much virus activity in our community to reopen the schools, that would be a Department of Health, and Drs. Anderson and Park would be making that decision. We are looking at percent positivity and being able to publish that in the dashboard so people can monitor it. And that is one of those that many communities are looking at as a key metric for when schools or other kinds of activities would be allowed or not allowed.
Lieutenant Governor Green is quoted in today's paper. He says, if we see another week of triple digits, the only sensible thing to do is have a 2 to 4 week shutdown, only essential work occurring to keep ourselves alive. That's a pretty dire statement. And so he's basically saying this is the week that's kind of make or break, if you will. Ryan and I were reflecting back on just, we've been having these conversations since March now, and it feels like we had such success in our grasp. Do you hold the same outlook as the Lieutenant Governor? Do you think that this is kind of the make or break week?
Well, I do think that, Yanji, I did personally see kind of a relaxation within the broader community that started around the Memorial Day weekend at first. It wasn't as widespread. Definitely the 4th of July weekend, there were a lot more people without masks on in the parks and at the beaches. You could see a lot more social gatherings, just potlucks amongst families and others. When I drove by this weekend, there at least seemed to be less than in the weeks directly after 4th of July. So, I think that we do need to see the number being contained. If it continues to increase during this whole week, then I'm certain that the mayors and I would be looking at further action necessary. We all know that a complete shutdown is not something that we would want to do because of the impact on our businesses. But if the numbers continue to increase, then we may have to do that.
We're seeing so many questions coming in, and we're trying our best to keep up with them because they're just flying in right now. So just to summarize, I apologize if we can't get your specific question in there, but to summarize some of the questions that are coming in, unemployment, another issue that continues to be plaguing a lot of people, especially with some of the pool side of things. We know that there have been mistakes made, that the ones that are not clean, deemed as clean claims, as you sort of say. And so those are the people that are suffering the most. We're seeing people saying they're waiting 13 weeks, 14, 17 weeks. A lot of people just still suffering right now. And with the $600 plus money coming to an end last week, is there any update you can provide on how these people who are still waiting can get more access to information or get support through some sort of help from the department?
We have been trying to validate the IDs of many of the claims. The ones in the PUA system especially are very difficult. We've been looking at tax records, trying to reach out to the counties, trying to see how we might use motor vehicle registrations and driver's licenses and other identifications so that we can sort through the claims that are fraudulent and the ones that are not. It has been very time consuming, and we continue to think of better ways for us. I mean, we know that we want to make the payment for those who are non-fraudulent, and the challenge has been there have been so many fraudulent claims filed representing hundreds of millions of dollars that we're just trying to, in the best way possible, identify those who have legitimate filings and claims that we would want to make payment on, and separating those from the fraudulent ones. And it has been very difficult.
Marge Bamford has a question that I think a lot of us are puzzled with every day, which is, where are the outbreaks stemming from? You have a lot more access to the individual cases and to the patterns that you're seeing. What would you recommend? I mean, I know it's social distancing and wearing a mask, but what specific activities are you seeing that have led to the outbreaks that we're seeing? Are they family clusters? Are they businesses? Are they recreation activity? What insight can you give us as to where the cases are coming from and the spikes that we're seeing?
Yanji, I think it's all of the above. We are seeing family clusters for gatherings at beach parks or on the beach. We have seen gatherings in the home, friends getting together for church services just because they're not as prevalent in the church settings. We've had a few cases of clusters in the workplace where co-workers are eating and meeting to have lunch without masks on. It's a wide range of individual activities that are generating the cases. And that's why if it was, let's say, if the half of the cases were in bars, then it would really be easy for us to just say we ought to go shut down bars. The challenge is that in many of the cases, the individuals don't or are not aware of specifically where they might have gotten infected. That makes it difficult. And then when you go through the contact tracing process and you ask them, okay, what activities have you been involved with? And then they say, well, yes, we had a picnic at the beach. I have been going to work. All of these kinds of individual things come up in the contact tracing process. And so, it's a challenge, again, re-emphasize with people. It's about wearing your mask all the time. Act as if you're infected and your mask prevents you from infecting others. Physical distancing at work and at home. Limiting social interactions are very, very important because that's what spreads the virus.
We're getting a lot of questions also about the inter-island travel because that is something that we know that some of the mayors have requested, is that we reinstate that 14-day inter-island travel restriction. Is that something that we could see realistically happening? Have we seen, as we look at some of these cases, that these other cases that are positive on neighbor islands are being traced back to Oahu? And could we see that implementation happen once again?
We haven't seen a lot of cases that are tied specifically to inter-island, Ryan. A lot of the neighbor island cases are people, residents traveling to the mainland more and coming back and infecting others. But, we continue to look at that. We are trying to capture the data in a way that would inform us. But I know when I looked at the data last week, there are like 13,000 inter-island trips in a typical week now. And we have just had a handful of cases that we could trace back to actually someone from Oahu traveling to the neighbor islands or vice versa. It's not a big number. And so, we continue to work with the mayors to try and make sure we understand the data and just make decisions that are appropriate.
We know that you have a hard out in about 2 minutes, but I just want to there's a bunch of questions about contact tracing. Is the Department of Health equipped to do this? Do we have enough contact tracers, or do we need to quickly hire more?
Yes, we have sufficient contact tracers on staff now, and yes, we need to hire more. We have been successful in training. There are employees within the National Guard in the medical unit that have been involved with swabbing and testing, who have also been trained on contact tracing. And so we are staffing up to meet the surge. That tends to be employees within the Department of Health. They might be in other areas that we will reassign into contact tracing, just like we did with unemployment insurance. And certainly looking at the National Guard as they are already activated to see which employees we could apply to help with the contact tracing challenge right now. But we do have sufficient numbers. I do want to assure people that the state of Hawaii continues to follow up on every positive case within 24 hours, and we get to all close contacts, or the goal is to get to all close contacts within 48 hours.
Before we let you go, maybe a final question here. Looking at the number today, we're getting reports of numbers over 200. Is there anything that you want to say about today's count, today's number? Is that a reflection of sort of the missed numbers that we saw yesterday? And what would be your message with, if it is an overwhelming number like 200, what is just that overall message that you would like to send to maybe end with here today?
Brian and Yanji, we can only be successful if we all take personal responsibility for reducing the transmission of COVID-19. And that impacts every single aspect of what we do every day. We need to wear a mask whenever we're in a room with other people. We need to act as if we are infected and we don't want to infect others. People need to physically distance in everything that they do. If you're sick, stay home. We keep continuing to say that. If you've been exposed, you need to quarantine until you know whether you're infected or not. We do know that younger people are infected now. We know that the symptoms might not be as obvious, and that you can be infectious even if you're asymptomatic or pre-symptomatic. So, anyone who has been exposed should act as if they are infected and isolate and quarantine, until they can get access to a test or until they're certain that they're not infected with the virus. We can only be successful together, and we all need to take personal responsibility and take actions to reduce the spread of COVID-19.
Okay, Governor David Ige, thank you so much for spending time with us this morning. We know you have another meeting coming up in 2 minutes, so we really appreciate you answering the questions that came in today.
Yeah, thank you so much for giving me this opportunity.
Thank you. Aloha.
Okay, so a lot to cover there. And, we see all your comments. We know a lot of you have questions for the governor. We did our best to sort of condense those and get to as many topics as possible. But let's go through what he talked about, sort of echoing, but not maybe as explicit as Dr. Green in the paper today, basically saying that this is the make or break week, that how Hawaii does over the next few days will really impact what happens to us in the coming weeks and months. So, re-emphasizing that personal responsibility and saying that a full shutdown is on the table, but of course, that is not something that he wants to do.
Yeah, and again, they are still targeting that September 1st, timeline of reopening the state. They recognize that as the sort of the time frame that they put forth, and that they're continuing to move forward with that. The likelihood of that happening, though, based on some of the numbers, will ultimately be dictated by these daily count numbers, which we have seen go up over the past few days now. And so, in talking about maybe travel bubbles with Japan, that could start up first. But right now, he's saying that they're continuing to move forward. He recognizes, too, about the need from the hospitality industry, that they need time, that the airlines need time to plan for this. So we'll see if that, in fact, happens. And if we see yet another delay in the reopening of Hawaii, which, of course, could significantly impact more businesses here.
Right. And then, of course, he also talked about schools and saying that, yes, it is a possibility that the counties could go in a different direction depending on what their viral load is. And I think that is, that's very important for parents on all the islands to take into consideration. And also saying that it could not just be county by county, but even school by school or classroom by classroom, that they really want to do targeted closures as opposed to blanket to really try to get students up and running by that new August 17th deadline. But we've seen your comments about the reported number today. We can't confirm that ourselves at this point, but if that is in fact true, then August 17th even seems ambitious.
Yeah, and we pressed him on that question. Governor did not want to specifically give us an answer on that number. Obviously the Department of Health has a system, and when they release it, and there are some officials who release that information before the governor or the Department of Health does. And so they're sort of just waiting for that official announcement to come about with more information on exactly what that number is from. Governor also, though, saying that right now he is not necessarily looking at re-implementing that inter-island quarantine, saying that there has not been many tests many cases that have been linked to this travel between islands. And so they will continue to monitor that. If they do see an uptick on the neighbor islands because of travel from Oahu, then obviously that is something that they will be putting back on the table. But as for now, that is something that seems to be not as much of an issue as maybe some of the other things that are they're having to deal with here on a local level, especially here on the island of Oahu.
Yeah, and a lot of comments coming in saying we want different advice or information other than wear a mask and socially distance. But really, that at the end of the day, it seems that is the best course of action. And that's really what the governor is advocating, that act as though you are infected and, go through life that way. limit your exposure to others as much as possible, even when you're indoors. And he really emphasized that this is not, we try to say, what's the pattern? What are you seeing here? One of the questions that came in, where are these clusters coming from? And it's really across the board. And it's things that, make a lot of sense, that you wear your mask all day in the office, but then maybe you and a colleague sit down and have lunch together and you're not wearing your mask. Having family potlucks where, yes, everybody, but have you been bubbling together? Probably not. So taking all of those things into account. He did seem to praise folks to say that he wasn't seeing the level of activity in terms of, recreation that he had seen in the past around July 4th. But still, it obviously is too much.
Yeah, and I have to agree. I mean, I echo that statement. I mean, I drove around the island a little bit this week, and there doesn't seem as many people that were out gathering as we saw maybe in recent weeks. But one of the other questions that we did ask was about the shutdown of parks and beaches, which we know are an area where many people gather. And he said they will continue to look at that. But interestingly, it could come down to what the mayors decide. If you remember back when the shutdown happened, it was actually each of the mayors on each of the islands decided if that shutdown was going to happen. And so that could actually be coming from more of a local level if that decision is made. And so we'll have to look here on the island of Oahu, of course, at what Honolulu Mayor Kirk Caldwell says about these gatherings and if there is any implementation there. There have been talks that there has been a request for that to happen. We'll see what the mayor says this week and continue to monitor that and keep you updated here on the Star-Advertiser.
Yeah, and we really appreciate you joining us. We know a lot of you are frustrated. We, in fact, are frustrated by what we're seeing because, Ryan, we were doing this 5 days a week, and then we actually scaled back to 2 days a week because the case count was so low that we found that there was less to talk about, and we really wanted to target the conversation. And now it feels like we are, right back to where we started, in fact, much worse. So that is very frustrating. And there's so much economic uncertainty, which is why we have chosen this month, the month of August, to focus on the economy. But of course, all things go back to COVID. On Wednesday, we'll be joining you again, and we'll be talking to Paul Brubaker. He's an economist with TZ Economics. He, for 25 years, was the chief economist at the Bank of Hawaii. And so he has a really great perspective and a lot of knowledge to share about Hawaii's economic outlook. A lot of people pay big bucks to see him speak, but we're going to bring him to you for free. So we're very excited to have him on, and he can really help to tie a lot of this data together and give us, an honest, fresh take on where we are financially.
Yeah, because we definitely know that as we sort of enter yet more uncertainty in this time of what's open and what's not open, of course, businesses will continue to suffer as we see more of these shutdowns happening. If we see the delay of the open of trans-Pacific travel to Hawaii, that could also, of course, impact businesses and the hospitality industry and what that has on the overall impact of the state. So we're looking forward to that conversation. Again, we want to thank our sponsors at the Office of Election for allowing us this conversation. A big week. Today is a big deadline. If you have not sent in your ballot, we remind you that today is technically the day that they are asking people to submit your ballots in the mail. They want, it is recommended that at least 5 days before the election, which of course is on Saturday. And so they want to make sure that you get those ballots in the mail. However, there are options if you don't necessarily get it in the mail today.
That's right. You could always go to a drop box, but they do want to recommend 5 days of transit time because remember, the ballot needs to be received, not postmarked by Saturday. This is a big election. They've already seen quite a few ballots coming in. They're already starting to count those. So very exciting to see who is going to be leading on a number of fronts. There's a bunch of interesting state house races, along, of course, with the mayor of the city and county of Honolulu and the city council as well. So a lot to talk about in politics. But yeah, if you've got that ballot at home and you haven't sent it out, try to do so today before your postal worker comes to pick up the mail.
That's right. So until we see you right back here on Wednesday, we encourage all of you to, again, continue to be safe, do what the governor says in terms of physical distancing and wearing masks. And we'll continue to keep you posted as things unfold here in Hawaii as we all deal with this COVID-19. But again, we encourage you to take care, and we'll see you right back here on Wednesday. Aloha.
Aloha.